welcome everybody. Welcome to Chiro Kings podcast.
Inaugural podcast.
Our first podcast. I'm Dr. Matt Alexander, and we got Dr. Chris Saincome here with us. And Chiro Kings podcast is a podcast for all things chiropractic. So our target audience are going to be people interested in chiropractic, maybe potential patients, current patients, even other chiropractors who want to learn more about different techniques that we're going to be discussing. They might want to learn more about the business strategy of chiropractic as well. We do plan on having some attorneys on some of our episodes and discussing personal injury, which is a big part of chiropractic as well. And we do little introductions. So I'll go first, and then I'll have Dr. Chris introduce himself as well.
Sounds like a plan.
So Dr. Matt Alexander, born and raised in Livermore. My dad was a chiropractor as well. We're actually going to get him on one of our future episodes too. And he started a practice, Alexander Chiropractic in Livermore in 1986. And I worked with him for a few years. Then I opened up another practice, eventually bought his, and then eventually bought two other practices. So now we have 4 practices. And I still live in Livermore, California with my wife and 4 kids, and just trying to grow our business. And things have been going pretty well. And I just love talking about chiropractic. Recently got a job teaching part-time at Life Chiropractic College West. And I've always had a passion for chiropractic, and I've always had a passion for the business side of chiropractic as well. And I think mainly that's because kind of an entrepreneur at heart, but I also like a challenge, and I feel like chiropractic is a real challenge for people to master the business side of it because we don't learn any of that in school. And so I've always tried to read a lot and constantly reading different books, E-Myth, a lot of different books about business, and that's helped, but I always knew there was still some holes in my business knowledge. So currently I'm actually pursuing an MBA in business to fill in some of those gaps that I know exist. Anyways, so we're definitely going to be talking about the business model of chiropractic as well. And so that's kind of my story in a nutshell. Chris, why don't you go ahead and...
Yeah. Hi, everybody. My name is Dr. Chris Saincome. I grew up in the East Bay as well as Dr. Matt, and I wasn't introduced to chiropractic until youth sports. And it's kind of the classic story where, you hurt yourself, you go see somebody, they take care of you, and that's how you get your experience. And while that was my story, it actually didn't occur to me to become a chiropractor until much, much later on. I was a competitive baseball player, and I slid into second base after hitting a double, of course. And I tweaked my back. No big deal. Go to the chiropractor, new experience. I get a few adjustments. It goes away. I don't think twice about it. You just go to the chiropractor when you got a back pain, right? And it wasn't until I went to the University of Oregon and I was studying human physiology where I realized, how am I going to get a job that I can use my knowledge about the human body to not only help people, but maybe pay down some of those student loans that I took out as out-of-state tuition at the University of Oregon? So I started to work in physical therapy. All my classmates were talking about physical therapy or medical school. And I thought, well, that sounds good to me. I want to work with athletes. I want to be in an outpatient orthopedic setting. And so I got a job as an assistant, and I loved it. The one thing that I did notice was how frustrated the physical therapists were about the profession. Not only were they frustrated with the lack of results because their patients weren't doing their home exercises or coming to their appointments at the regular schedule, but they also expressed that they were struggling financially. They had huge student loans. They worked at these small companies that had no upside. And that wasn't what I wanted for myself. I wanted something that I could, bust my ass and make a little bit more money and help more people along the way. So I was studying the neurophysiology of concussions, and one of the success stories was talking about, I forget the gentleman's name. He's the QB for the Buffalo Bills. And he was a concussion. He had multiple concussions because he was a scrambler. And unfortunately, it cut his career short because he had so many neurological issues due to compression in his spine and repetitive stress, like the CTE kind of stuff. And the success story came after he saw a chiropractor who focused on working on the upper cervical spine. I think it's Jim Kelly. Was it Jim Kelly? But he saw a chiropractor who adjusted his atlas, or the first vertebra in his neck, and he noted that he felt this flushing sensation where the cerebral spinal fluid in his brain finally had a reset where it was doing what it was meant to do, which is circulate through the body and exchange those nutrients or byproducts of the metabolic features in the brain to provide better physiology and better dynamics to his nervous system. And I said, I thought chiropractors just did neck pain and low back pain. Like, what do you mean it was affecting his brain and his cognitive issues that he was having, his migraines? And I also came from a family that suffered from chronic migraines. So I made the two connections. Well, maybe I should go see a chiropractor about these headaches. And that was my aha moment. Mm. It was like that where I saw immediate relief in my severity or frequency of headaches. And I thought, well, this is a pretty cool profession. I can not only work with athletes, but I can affect the nervous system. So long story short, I applied to chiropractic school. I loved it from start to finish. I did the accelerated program, so I was out in 3 years. I connected with Dr. Alexander as a student. I came on as an intern. I learned how he and his father developed their system of chiropractic, which was a system without any hard sales. It was a system that was patient-centered, and that really vibed well for me. I slept good at night, knowing I was helping people, making some money along the way. And thankfully, Dr. Alexander brought me on as an associate doctor in his Livermore office. It's the oldest and most established. And as the company grew, there became this increasing need for help running the business. You know, Dr. Matt was stretched thin. He was running multiple businesses. He had his family to take care of. So I came to him and I said, let me help you with Livermore, and you can focus your efforts elsewhere. And that's exactly what we did. And that's where I found that I maybe had a little bit more to offer than just adjusting. I could help with some of the managerial aspects of the business. And as the company's grown, I've grown within that role. And here we are today where we have 4 practices with the 5th one on the way, and with the bright eyes and bushy tails looking to grow the thing more. And we are developing the system of chiropractic that we're calling AIM. And that is how we are going to systematize not only the chiropractic to help young doctors become better doctors, but also teach them how to maybe run a business someday and provide the best quality of care for their patients while also making a buck along the way.
Nice. I got a little story about when Chris first came on as an employee, because I had hired him as a preceptor, which is, for those of you who are not chiropractors, that's where a student will basically work in a chiropractic clinic outside of the school for a few months before they get their license. And so Chris had worked for me as a preceptor, and I told him from the beginning that I was not going to hire him as a doctor after he got licensed, because I didn't need another one.
Well, that was the thing. I thought I had my big break. I was accepted into this practice to be an intern to learn how to do it, and I got there, and I love the guy now. He's one of my close friends, but Dr. Arnott Adler is sitting in my station where I didn't even know there was going to be a new doc, and he had gotten the job that I was hoping to apply for.
Right. So Chris comes to me and he goes, I know that you're not looking for another doctor right now, but I will make you money. Like, I will work hard for you. I'll be your best employee. I'm going to show up on time. I'm not going to complain. And I will make money for this company. And I never had someone sit in an interview like that with me and sell themselves. Most people just sit there in an interview and they wait for the interviewer to ask them questions. And you were actually actively selling yourself, to me, and I liked that. Yeah. And so I thought to myself, you know what? I want this guy working for me, so I'm going to create a position for him. And I did, and it was one of the best decisions I made.
I appreciate that. Yeah, I was so excited about what I saw at the practice, because in chiropractic school, they teach you how to take care of patients, but they don't teach you what it looks like in the real world. There is no a patient comes in, they get this experience, they get this care plan, we get these results, and this is how we try and make sure that they have a great experience along the way. There is none of that. And I had learned under the Alexander Integrated Method System what it looks like to be a chiropractor in the real world and take care of Livermore, which was a beautiful community, lots of young families. It's a diverse community too, with old ranchers or young families. And the system worked no matter who we were taking care of. So yeah, I wanted in.
Yeah, I mean, and to your point with the chiropractic school thing, it's not their fault. That's not their job to teach you business necessarily. They're a chiropractic school. Their whole job is to create good chiropractors, and I felt like they did a good job of that at Life West. They gave us a lot of technique, a lot more than a lot of the chiropractic schools give you, but there is that business factor, and the school, it's not really in their interest to tell students that a lot of doctors are struggling out in practice.
Yeah.
Because they need students, they need butts in the seats to pay the bills that they have, just like any business does. Even if they're a nonprofit, they still have bills to pay, and they need students in the door, right? But it is a real problem. And so the AIM, which stands for Alexander Integrated Method, is not just a system of caring for patients, but it's also a system that provides a business model for chiropractors so that they can ethically practice and help as many people as humanly possible and actually make money to feed their families and pay back their loans and have a meaningful, real career. And I think that's what's lacking for a lot of chiropractors coming out of school today.
Yeah, I totally agree. There's no, you go to chiropractic school, you graduate with good grades or poor grades, but you graduate and you can get a job at a hospital making $150,000 with full benefits. It just doesn't exist for our profession. And as much as we don't want to discredit certain avenues that people go outside of school, like the most common path for maybe a young doctor might be going to the joint, that is at least a job for people to come into. Because the idea that a lot of chiropractors fail because they got to literally graduate and then go figure it out.
Yeah.
And there's this saying in chiropractic that chiropractors eat their young.
Mm-hmm.
There's going to be an established doctor who's going to try and get someone cheap and doesn't teach them anything, just see the overflow of patients, go do this, that, and the other, and let's make sure that I'm still getting my money as the main doc. And that's not going to build our profession.
No, it's going to drive people to burn out and get out of the profession.
Right.
And it's really sad, actually. And I think it's actually not in the best interest of that main doctor either, they're going to just keep milling through associate doctors.
Yep.
New doctor comes in, they work them to the bone for 2 years, barely pay them anything. The doctor gets frustrated, leaves, and then they got to do that again.
Right.
And the patient's got to get used to another new guy, and it's really a horrible business model, in my opinion. You gotta pay the people fairly so they'll stick around, and you got to treat them right. So I'm not in the interest of just having one small practice and taking as much profit out of it as I can and just working everybody else to the bone. Like, my main mission would be create a meaningful career for chiropractors where they can come in and they can start maybe as a preceptor and move up to an associate and then move up to maybe running the clinic as a clinic director and then maybe, getting even higher positions like where you're at now, running multiple clinics. And I think that's a more fulfilling career when they're, like, you to use your term you said earlier, there's an upside to it.
Yeah.
There's a career path to it.
Right.
And really, it's not that I'm paying new doctors coming out like amazing. I pay them probably better than most, but not, it's enough to live off of, but there's a lot of upside in potential if they work hard.
Yeah.
And I think, what was it you were saying the other day about you get what you...
Yeah, I mean, I think if you have the mentality to grow and you want to provide more, like you said when I was doing my interview, I wasn't just waiting for you to ask me questions. I was trying to show you that I'm going to provide value. That will come back tenfold. Yeah. And I think that's the mentality that is not really necessarily in the chiropractic profession, unfortunately. It's either the go-getters or the top percent go and get all the patients and have successful clinics, and the bottom half thinks, I'm not getting enough right now, and this isn't going to work out for me. Maybe I should go do something different. And that's what I want to avoid. I want that bell curve to be less of the 1% making all of the money as the chiropractors do, but have a stable profession where we have more chiropractors treating more people, because that's our mission, is to have more people under chiropractic care.
Exactly. Yeah.
So.
Well said. So now you guys kind of know what our company is about and what our mission is. We're going to be covering all sorts of topics, chiropractic technique, ancillary services that go along with chiropractic, anything health related we're really interested in. And
I think if someone, excuse me for interrupting,
go ahead.
I think if someone is looking to better understand chiropractic and also see how it actually works in the real world, this would be the podcast that they actually can put on in their drive and actually appreciate what we're doing. I want people to know that one of the things that actually is a detriment to chiropractic is how different everyone is.
Yeah.
And I don't think there's a dialogue between chiropractic offices as much as there is, or as much as there should be, I should say. I think that it's more, that person down the street is my competitor. I don't want to talk to them. I don't want to tell them what I'm doing. We're only seeing as chiropractors 10% of the population, and that's not good enough. So there's plenty of patients to go around. If our systems are improved and we have better communication between chiropractors, that's one target audience that I want to be a part of this podcast, that improves the profession as a whole rather than just.
Yeah. Well, California is not always easy for small businesses.
Yeah.
And as you might be aware,
here we go. We're going straight into it.
No, we're gonna try to stay as much out of the political and religious conversations out of this pod. I think chiropractic can get heated enough for us.
Yeah, exactly right.
But you know what? A lot of people are leaving California. Prior to COVID, there were 16,000 chiropractors practicing and licensed in California. And after COVID, now we're down to 12,000. That's a 25% decrease. Now, it's not hitting the areas as hard like Livermore, Pleasanton. These areas are still a lot of chiropractors, but you get out a little bit further away into the valley in different areas, there's a lot of underserved communities that just don't have access to a lot of services, including chiropractic. And I think that you're right. Like, if we want people, there's a lot of people that have these migraines, like you're talking about, and these suffering from this stuff, and they just simply don't know about it. And it's a shame when you see chiropractors that are going out of business because they just don't know how to run a business.
Yeah.
And so you're just left with people who need the service, aren't getting it, frustrated chiropractors. So I think that's your and I's mission, right, is to help people by helping those chiropractors as well, to teaching them, improving their technique, helping them to be excellent chiropractors, and helping them understand how to take a patient in, examine them, listen to them. A lot of doctors don't listen to people anymore. Actually figure out what the root cause of their problem is. So we use digital x-ray in our offices because we think it's really important that we know exactly where the problem is. And then when we have an accurate diagnosis, then we can come up with a real treatment plan. It's not just, we'll come back next time it hurts. It's like, no, we know what the problem is. We're going to fix the root cause of it so it doesn't keep coming back.
Yeah.
And a lot of docs now are not even utilizing x-ray. And you can practice that way. I personally feel like you are going to be more accurate if you do utilize them.
Couldn't agree more.